Hey guys, it's Dr. Justin Marchegiani here. Just left a float therapy session over here at Zero Gravity down in Austin, Texas. Great little wonderful Sunday here. Again, float therapy, just wanted to kind of talk about a couple of the benefits of it. I think it's a really great thing, especially if you get that sympathetic nervous system, that fight or flight going. I think it can be really helpful to get the parasympathetics activated and the sympathetics down. So I'm going to just do a quick little kind of top 3 to 5 benefits of it. So number one, to have a really healthy float therapy environment, you need about 1,200 pounds of magnesium salts. And this is great because magnesium really helps relax the nervous system. It's a natural beta blocker, which is great. Again, because it's absorbed through the skin, if you have any gut issues, you're going to have maximal absorption because it's going to the skin. So you get that magnesium chloride into the bloodstream. It's going to have that dampening, that relaxing of the heart rate. It's going to help vasodilate a lot of the blood vessels, which is really great. A lot of studies show it helps to reduce muscle tension. So the muscles are really, really tight, right? Lots of adhesions, lots of scar tissue. It helps relax that, which is excellent. Also, if you do a really good float therapy session, you're going to be in a really dark environment, which is going to be great. And that environment is going to really help you to relax and turn your brain off a little bit. So when I'm in there, I do some of the Wim Hof breathing, where I'm breathing in through the nose and all the way out through the mouth, but really pronounced and deep. So it's out. So the goal really is to breathe out so much of that CO2, to breathe out a lot more of that oxygen, and then it creates, let me make sure I get this right here. So by breathing in and into the nose, you get the parasympathetic fibers activated. Out through the mouth, you're breathing out a lot of oxygen, so you're allowing the CO2 levels to accumulate. Actually, other way around. Back up. By breathing in deep and out deep, you're allowing the oxygen levels to accumulate and the CO2 levels to go down. So you're decreasing CO2, you're increasing O2. So then the goal, the next step is then you breathe out, hold till you comfortably can't breathe anymore, and then you breathe in, hold, and you do that maximally, and the goal of that is to switch and bring the CO2 back up. So you're having this environment where you're really getting the O2 up, where you get the tingles going, and then you're breathing out, holding, in, holding, and that switches the ratio and gets the CO2 going. So that's kind of what I do. So you get the really good magnesium-rich environment, a lot of sensory deprivation. You're in the water, it's totally dark, really relaxing, which is great. The magnesium has a really good effect on the arteries, on the heart, on the muscles, really helps relaxing the body. And then you do the breathing, and the breathing's super helpful. One, to modulate the O2 with the deep breathing, and then to modulate the CO2 with the breath out, hold, breath in, hold. It really helps the nervous system. The next piece is gratitude. So I'm a big fan. When you're there, you can really work on gratitude, just focusing on the good things that are in your life. That really helps activate parts of the mitochondria. If you read Dave Asprey's new book, Headstrong, he talks about that. He'll actually be here in Austin, Texas this next week. I look forward to attending that talk. But that'll really help activate the mitochondria as well. Now, afterwards, I had some chamomile tea, and I'm actually going to go get a nice little green drink down the street here, organic green drink, and I'm going to put about 2 scoops of collagen in it and maybe some MCT, so we get some good fat, good protein, good healthy micronutrients. Awesome, Dale. Yeah, try that over in where you're at up in Canada. That should be great. So any other questions you have about that, feel free and chime in. I'll be able to answer them for you as we go too. But outside of that, lots of good benefits there. I think people should engage in activities that really get the parasympathetics going. I think it's really, really excellent. Yeah, awesome. Dale's doing the Wim Hof as well. Big fan of it. I think it's great. Also, just simple things too. When you start your day, end with a cold shower. So you can start your day, shower, do your thing, clean yourself up, and that last 2 or 3 minutes with a nice cold shower. That's going to activate the hypothalamic pituitary adrenal axis, which is great. And then getting some good sun first thing in the morning, you really get that HPA axis stimulated. So float therapy, right? Relaxation, breathing, gratitude, magnesium really help relax the body, and that really starts to put your body in a parasympathetic state where you're building up faster than you're breaking down. And that's the goal, is really making sure we're healing and recovering a lot faster than we're breaking down. Any other questions, I'll feel free and answer them here. Anything comes in, let me know. So outside of that, nice little Easter Sunday down here in Austin. Beautiful weather. I'm gonna go head to the gym right after this, and I'm going to. Hold on, a question came in here. So Robert wants to know parasympathetic response doing a teeter hang up. Not sure what that is, Robert. Not sure. You have to give me a little more elaboration. But I'm gonna go head to the gym right now and go do some Tabatas. Just 5 minutes, 20 on, 10 off, and then I'm gonna do some TRX pushes and pull movements. Pretty simple, and then just call it a day, and I'm gonna go hang out with my wife and my dog. What do you prefer, the pods or the chambers? I was in a chamber. I like the chamber. I've never been in the pod before, but I like feeling like my periphery. I want to feel below me and the side of me. I don't want to feel like I'm out in the middle of nowhere, because my first minute in there when I did it before, I had like a little panic attack, because you're like, where are you? And then once I kind of had my bearing, I felt good about it. So that's really good. So I like the chamber where you open up and it's totally enclosed, and the one that here at Zero Gravity in Austin, they have the light that's on, and then within 5 minutes it gently goes off. I like that, because then you can kind of get your bearing where you're at, and they have a nice little towel on the side and a spray bottle, so if you get the magnesium salts close to an orifice, your nose, your eyes, you can always wash that off. So I like that here. Any other questions, let me know. So I'm heading to the gym. Oh, the device hang upside down. Yeah, that's great. I did a podcast with Andy Nilo. He starts his day with that as well to get the parasympathetics going as well. Really excellent way to do it for sure. I'm heading to the gym. I'm doing some Tabata. I'm doing some pulls, some pushes, and then maybe just some simple bodybuilding movements. 15 minutes max at the gym today, keeping it really simple. Beautiful day. And then I'm going to go for a walk, making sure I get my 10,000 steps. And then I'm going to head downtown for a nice little dinner to celebrate my wife's birthday. So really excited about that, guys. Any questions, keep it coming. I'm going to do more of these live sessions more frequently. So great connecting. Have an awesome, happy Easter Sunday. Take care.